ABCs of NMOSD is a 10-part education podcast series to share knowledge about neuromyelitis optica spectrum disorder, or NMOSD, a rare relapsing autoimmune disorder that preferentially causes inflammation in the optic nerves and spinal cord. ABCs of NMOSD podcast series is hosted by SRNA, the Siegel Rare Neuroimmune Association, and in collaboration with the Sumaira Foundation for NMO, the Connor B. Judge Foundation, and Guthrie Jackson Charitable Foundation. This education series is made possible through a patient education grant from Viela Bio.
Welcome to the ABCs of NMOSD podcast series. Today's podcast is about psychosocial aspects of NMOSD, anxiety, depression, and how to cope. My name is Chrissy Dilger from the Siegel Rare Neuroimmune Association. ABCs of NMOSD is made possible through a patient education grant from Viela Bio. Viela Bio is dedicated to the development and commercialization of novel life-changing medicines for patients with a wide range of autoimmune and severe inflammatory diseases. Their approach to drug discovery is aimed at providing targeted treatments for improved outcomes for the thousands of patients who have few or no therapeutic options. For additional information about Viela, please visit vielabio.com. For today's podcast, we are pleased to be joined by Katherine Chapman. Katherine Chapman received her bachelor's degree in sociology and Master of Social Work at Louisiana State University. She received her board certification in 1998 and is a licensed clinical social worker. Katherine has been at the Multiple Sclerosis Program at UT Southwestern since September 2002. She works with a dynamic multidisciplinary team in the Concord Clinic and the team at Children's Health Dallas, participating in research and patient care. She assists children and their families by locating resources, providing support and information. She serves as a therapist in the adult clinic, assisting people with MS, NMO, and TM to manage depression, anxiety, insomnia, and general life stressors. Welcome, Katherine. Thank you for joining us. Can you just begin by explaining how NMOSD can affect a person's mental health, and why does NMOSD cause anxiety and depression in some patients?
Well, thank you so much for having me. We know that any new diagnosis like NMO can be very shocking and disruptive to individuals and their families. Everybody shares the impact. And then there's so many additional stressors that are put on people with their health and the unpredictability. It can be expensive. There's lots of decisions to be made, and then symptoms to deal with it may not necessarily be visible, like symptoms of pain. And every family and person is going to react and adapt in their own way and in their own time. So please try to put down any expectations of how you think you or others should feel or think, and let yourself know that all feelings are okay. You have a right to feel what you feel. And we don't know exactly why, it's a complex thing as far as depression goes, because there could be a biological basis. And we see this in MS. So I think it would be fair to say that this could be the case for NMO too. And we don't have the research yet. But again, I think it's fair to say that there could be some interaction there. And then definitely people can have depression and anxiety as a reaction to having NMO. And that is entirely normal to just feel all kinds of emotions after a new diagnosis or a change in function. And some of those common reactions are anger, sadness, the anxiety, depression, and grief. And you might just feel like you're on an emotional roller coaster. That is totally normal.
Okay, thank you. I think that was a really good explanation. So the next question is, how can a person tell whether they are experiencing anxiety or and or depression. What are some common symptoms? I know you just mentioned grief and anger, but I guess how do you determine whether these are just normal emotions or something that's a little bit more serious?
Serious. Yes, yes. And sometimes it is challenging to figure out between those things. But as far as depression goes, recognizing that, you're looking at if you're feeling a certain way for 2 weeks or more. We all have our good days and bad days, as far as our emotions go. But with depression, it really sticks around and you're feeling sad most days. That could also look like irritability. And then the other hallmark of sadness or hallmark of depression is having little or no interest in doing things that you generally enjoy doing. So if you had some hobbies or you hung out with some particular groups or friends and you just really don't want to do that, that might be a sign. And then other things that could be depression with those two things is weight gain or loss, having trouble sleeping, having difficulty making decisions, trouble with your concentration, feeling guilty or unworthy, and then thoughts of death or suicide. So if you are having any of these, difficult emotions, please reach out for help. And we'll be talking about that. Talk to your family, your medical team. And if you're struggling, if you are struggling with depression, please reach out for help. And because the good news is it can be treated. There are so many things that you can do and strategies to learn to deal with depression and anxiety. And for anxiety, which is also very challenging, you're having excessive worry, like you can't control it. It's just worrying all the time, having a really hard time relaxing, feeling anxious and on edge, or feeling scared, like something really bad's going to happen. And often anxiety and depression go alongside each other. So it's not unusual to have both.
Okay, great. Thank you. So, for someone who is diagnosed with NMOSD and experiencing anxiety and or depression for the first time, where is the best place to start for treatment? Would you recommend therapy, medication, self-coping strategies, or anything else?
Okay, well, yes, all of those. I would start by talking with family or figure out who is your support network, especially newly diagnosed. Who are the people you can count on? Who is going to be there for you? And try to find at least one friend or family member that you can count on. But try building your support network, and please talk to the medical team. But therapy and exercise are a great place to start. And certainly medication can be very helpful in some cases. And, this is how this was described to me. If you feel like you're in the ditch, the medication can be your tow truck to get you out of the ditch. And then you do therapy and exercise to help you stay on the road while you're learning new skills and ways to cope. And there's so many benefits to therapy. It can help people reduce stress, work through problems, understand their thoughts better, and just have someone safe to talk to and that's objective and not in their close circle, and improve coping skills.
Okay, great. Thank you. So, what are some of the most common coping strategies or coping skills for anxiety and depression that's caused by NMOSD?
Okay, well, this is a great question. And depending on the therapist or counselor that you see, there is all kinds of different lines of therapy out there. But I would start with focusing on wellness. That is very key in managing stress. And stress can be tied into so many symptoms too. But doing the diaphragmatic breathing, if you're not doing that, try to take time in the day to do that. And I would encourage everybody to adopt some kind of guided meditation practice. One of my favorite apps is Insight Timer, and there are tons of free meditations on there to listen to. Exercise, Journaling, that can really help you identify healthy and unhealthy patterns, help you with making decisions, also being in nature. And another way to promote your wellness is that you need to protect your time. So you may need to say no to things, but that it's healthy to have boundaries and give yourself permission to say no. And a good rule of thumb is just give yourself at least 24 hours to think about, is this something I want to do? And because this really is a time to prioritize what is important to me and start with small changes, but think about, is there anything I can cut back on or eliminate, not activities, but maybe commitments that I'm not really into, trying to distinguish between those and what are the things I really want to be doing. And then, of course, something that I start people off with usually is a self-care script and really thinking about what are the things, how do I want to feel? And then what are the things I can do to promote those feelings? So there's so many different things you can do, but you might want to feel energized or joyful or peaceful. And then think about, well, what are the things I can do to promote those feelings? That might be exercise. It might be eating nutritious food. It might be focusing on sleep, which I think is the foundation of our health. Making sure that that is in order. Also, having alone time, having quality company, having time just to putter around or hobby time, and then just thinking about those things and allowing yourself to practice self-care because it's so essential, especially now.
I think that is a really important part of all of this. Self-care is something that we don't always prioritize, but we definitely should. There are many different types of therapies and mental health professionals. For example, counselors, social workers, psychologists, psychiatrists, and more. What kinds of therapies work best for anxiety and depression? And which type of medical professionals are able to best administer these therapies?
Yeah, so I think there's like questions that you might want to ask when you're looking for a therapist. Like, do you have experience with working with people with chronic illness? Do you offer video visits? That's important right now for a lot of us. Do you take insurance? And a lot of times therapists will do a 10-minute conversation with you so you can kind of get an idea of what is their line of therapy. We know cognitive behavioral therapy definitely has helped people who have MS and lots of other illnesses. It can help people conquer insomnia. It's just a very popular therapy that I use. And it's really recognizing how your thoughts and behaviors are impacting your mood and how they're so connected. But there's all kinds of therapies out there. So again, I would see if you could talk with licensed professional counselors, licensed clinical social workers like myself, psychologists, psychiatrists, and talk to your doctor and see if they have any recommendations. They might want to refer you somebody who they know has experience with NMO, or someone on the medical team might have that information. Then of course, reach out to the SRNA. There's so many support groups. They might have someone they could recommend. Yeah, and just give it a chance. There is no shame at all in getting help and seeing a therapist. I think it's amazing when people want to, practice that self-care. And I think that's one of the things therapists can help with too, is helping teach people those skills to relax and making sure that they are prioritizing themselves and doing whatever they can for wellness.
Great, thank you. So, what medications work best for anxiety in a person who may experience panic attacks?
So this is a great question as well. And I'm not a medical doctor, so I can't comment on any particular medicines, but definitely talk with your neurologist, or if you have a psychiatrist, they certainly will be able to prescribe something. And or a lot of primary care physicians are very comfortable prescribing antidepressants and anti-anxiety meds. And just one thing to keep in mind, a lot of these medicines take 4 to 6 weeks before you see the full benefit. So just give it a chance. But if it's not working, then you go back to your physician and tell them, this is not helping, and they'll figure out something else that you can try.
Okay, thank you. So, how do we deal with mood changes with NMO? This person's son has mood changes and it's hard to deal with.
Yes, I think this is probably a challenge for a lot of family members. And, friends and families can definitely make a difference. And I think I would let your loved one know that, or your son, that you are there to listen and help, and practice flexing your athletic listening muscle, because that will really foster love and productive dialogue. Do your best not to make assumptions. And some of the questions you might want to ask questions like, is there more that you want to say about that? Could you tell me more? How do you feel about that? There's no wrong or right feelings. Ask them, how can I best support you right now? And then some tips on just open and positive communication is to give people your full attention. Get rid of the screens, turn the TV off, don't have your phone around, so that person knows that you are fully present there listening to them. And practice using I statements to communicate how you feel. So, instead of saying like, oh my gosh, you're so selfish, you never help me with the dishes, try instead stating your feeling in a request. So, I had a really hard day and I feel so exhausted. Can we hang out for a little bit and then do the dishes together? Because when you are doing the you statements like, you're so selfish, that generally makes people feel defensive, and then being defensive basically shuts down any effective communication. So that's another important thing, is really try to not take things personal. And, again, we can't assume or think that we can read other people's minds. That's a very common thinking trap, is that thinking they can read our mind, or we can read theirs. We definitely can't do that. Give everyone a turn to talk. So take turns with being the speaker and the listener. So you may even want to validate the feeling, that someone's discussing, like, oh, that makes perfect sense to me that you would feel, so frustrated about those symptoms. And just try to come from a place of love and non-judgment, no blaming. And if you do find yourself getting really frustrated in conversations, please, again, practice breathing, exercise. You might want to put a hand on your heart, a hand on your stomach, and just really pull in that diaphragmatic breath into you and feel it coming in and out. And you might want to, even before you have a conversation, agree to take a time out if things are getting too heated and meet at a later time. Practice self-soothing. Again, trying not to take things personally. And you might even want to write down what you want to say before, so that you have it there and can clarify what you want to talk about.
Great, thank you. And then, are there any community resources you know of for people who don't have health insurance or the financial resources to pay for therapy?
Okay, yes, there definitely is options out there. So in most states, you can call 211 and ask them what places in my area have sliding scale counseling. Also, if a good place maybe even to start is if you are working, to check into your employee assistance program at your job, because sometimes they will provide free counseling to the employee and their family. So that's a possibility. Check with schools and universities, like at UT Southwestern, we have the UT Family Study Center, where they don't even bill insurance. It's just a $20 flat rate for families. So I would, try those things. I think there's definitely help out there if you need it.
Those are some really good suggestions. Thank you. Then, how can a person with anxiety and depression explain this to their family and friends? And for some people, the stigma of mental illness can keep them from reaching out for help. Do you have any advice for someone who may be feeling this way?
Yes, I mean, I think it's so important to have that open communication with your family, and again, letting your loved one know you are there to listen and help, and who is part of y'all's support network. Even maybe writing out a list of things that people can do, because a lot of people want to help, they're just not sure what to do. But if you can give them a list, these are things that we would love for somebody to do, and let people pick, and don't assume that they don't want to do that. Just please give them the option of letting them decide if they can do that or not. And so I think, yes, family and friends can definitely help. And back with like the mood changes, it is very difficult to be around somebody who is depressed or anxious. So please, people, have self-compassion for yourself. And I'm very big on this, in being very kind and gentle to yourself, treating yourself like you would a great, really good friend. And also just realizing, that everybody is going through some suffering, and that we're all connected as humans. And when you're practicing self-compassion, you're being mindful instead of like ruminating over things. You're being mindful of your present moment and just really taking it in and practicing that. So again, like with the mom, with her son, I would again just say, please give yourself compassion. It's okay. It's not going to be perfect. I'm doing the best I can. And just being really gentle with yourself, all the family, because I think it takes, again, all the family is going to adapt in their own time. We can't put any expectations on that, but people just need space and time to process, what their new diagnosis and what this means to the family. And I just so encourage people to not cut out fun recreational things. Please keep up with date nights. Please have family nights of fun. Keep up with outside activities and encourage the individual and the family to keep up with those things. I just think that's so helpful, just so helpful, to keep up with those things. And again, just letting your family know that you're there to talk and practice that active listening skill, the skills that we were talking about.
Okay, great. Thank you. I know you already touched on this a bit, but are there ways for family and friends to help someone who is experiencing depression and anxiety? And if if a family or family member or friend notices someone is having trouble, but that person hasn't reached out to them yet, is there anything
Mhm.
for that family member or friend to do? Or is it best to just wait and let somebody come to you?
Well, I think you could, gently, in a respectful, loving way, tell them things that you might be noticing, different symptoms or depression or anxiety. Because certainly, if they are recognizing that in their loved ones, they it can be treated. So you want them to get help. And this is something that it was from a movie that I saw about suicide, and they use this ACE where you ask, so you just basically directly ask people, are you having suicidal thoughts? Engage with them, let them know you're there to listen, and that you care. So it's ask, directly engage and care. And that engaging and caring part can be, helping them to find a therapist to work with, or get them to their doctor and be in on the visit and bring a list of questions. And I think most physicians are going to know that, all these emotions or depression, anxiety, that these, are common in the population, but just especially more so when you're dealing with NMO.
Okay, thank you. I think that is the end of our questions we received. Is there anything else you wanted to add or touch on before we wrap this up?
Yes, we'll do, I guess, just a couple take home points, that just every person and family is unique. They're all going to have their own challenges, and just that not everything is going to be about NMO. You've got other challenges, in the world right now. So, just remember, it's not always about NMO. Again, don't eliminate recreation. Please do the fun, keep doing those fun things. Limit your news intake and social media, because that does stress out a lot of people that I work with. And just know that it takes a team. And, as a medical team, we want to be there for you and your family. Try to do something that's relaxing every day. Give yourself permission to do that. It's just not even optional now. It's essential to be eliciting that relaxation response every day, which could be through listening to music, repetitive sounds like listening to ocean waves, repetitive prayer, aerobic exercise. That's another one. And just, noting your body, like, where am I holding tension and tightness, and work on your breathing to try to release some of that. And then use your inner and outer resources. Please reach out for help. I'm just going to give the suicide hotline just in case. It's 800-273-TALK, 800-273-TALK. And again, if you're a family member, just ask, engage with them, care about them, and try to help them, the best that you can. And self-compassion, please check out selfcompassion.org. There are guided meditations on there to help you build compassion for yourself, and exercises you can do, and just recognizing, that we're not perfect, but we're going to be okay.
Great. Thank you so much. And thank you for your time today. I think this resource will be very helpful to all of our members. And I think it's a really important topic that deserves this attention. So thank you.
Yeah, definitely does. And thank you so much for having me. I really appreciate it.
Thank you.